Assalamu alaikum dear students. Today we will discuss Midwifery and Gynecology MCQs part 3rd. Following positions are used for a vaginal examination. Option A, prawn. B, IUD insertion. Option C, lithotomy. Option D, spine. So the correct option is C, lithotomy. Polycystic ovarian syndrome is associated with all except option A, spine. B, anovulation. C, hypoandrogenism. And option D, obesity. So the correct option is C, hypoandrogenism. The ideal method of contraception for lactating mother is option A, IUCD. B, combined oral pills. C, progestin only pills. And option D, condoms. Correct option is C, progestin only pills. When does quickening typically occur in a pre-migrivida? Correct option is option A, 8 to 10 weeks. B, 12 to 14 weeks. C, 16 to 18 weeks. And option D, 20 to 22 weeks. Correct option is C, 16 to 18 weeks. The most important step in preventing postpartum hemorrhage is option A, suturing episectomy. B, fundal massage. C, immediate cord clamping. And option D, active management of third stage. So the correct option is D. So which of the following is a risk factor for uterine rupture? So the correct option is A, previous cesarean section. Which presentation is most favorable for vaginal delivery? Correct option is C, lochia serosa is characterized by option A, red bloody discharge. B, yellowish white discharge. C, pinkish or brownish discharge. And option D, fuel smelling greenish discharge. Correct option is C, pinkish or brownish discharge. HELP syndrome includes all the following except option A, hemolysis. B, elevated liver enzymes. C, low platelets. Option D, hypernatremia. So the correct option is D, hypernatremia. Which of the following is not a part of active management of the third stage of labor? So the correct option is D, uterine exploration. Which is the most reliable method for assessing fetal well-being? Correct option is B, non-stress test. The fetal heart rate can first be detected using Doppler ultrasound at option A, 4 weeks. Option B, 6 weeks. C, 10 to 12 weeks. And option D, 20 weeks. So the correct option is C, 10 to 12 weeks. The most common site of ectopic pregnancy is option A, cervix, B, ovary, C, ampulla of fallopian tube, and option D, isthmus of fallopian tube. Correct option is C, ampulla of fallopian tube. Which of the following is an indication for caesarean section? Option A, transverse line, B, cephalic presentation, C, occipital anterior position, and option D, engagement of head. Correct option is A, transverse line. The most effective emergency contraceptive method is option A, so the correct option is B, copper IUD insertion. Bartholin cyst is located at posterior vaginal wall, B, anterior vaginal wall, C, 4 and 8 o'clock position of vulva, option D, labia majora. So the correct option is C. Sheehan's syndrome is due to pituitary hemorrhage post-pregnancy, B, thyroid dysfunction, C, uterine rupture, and option D, adrenal failure. Correct option is A, pituitary hemorrhage post-pregnancy. Turner syndrome karyotype is option A. Correct option is C. Which condition presents with a snowstorm appearance on ultrasound? Option A, ectopic pregnancy, B, partial mole, C, complete molar pregnancy, and option D, missed abortion. Correct option is C, complete molar pregnancy. What is the treatment of choice for CIN3, cervical intraepithelial neoplasia? Option A, observation, B, cryotherapy, C, leap or cone biopsy, option D, pap smear every 6 months. Correct option is C, leap or cone biopsy. Thank you for watching my videos.